So moving on to chapter 12, which is skin medications. Some of you probably already did in your drug project a few skin medications, so you'll probably be familiar with them. They're broken up into 9 different categories. First, we have antipruritics, which relieve itching, corticosteroids, which can also relieve itching and swelling. Usually they're used in allergic reactions. Emollients and protectants, which provide some relief to skin that might be irritated, or it just protects the top layer of skin. Keratolytic agents, which loosen epithelial cells. Basically, they kind of help to get rid of that dead skin on the top. Enzymatic agents, which are good for removing dead tissue. Scabicides and pediculicides, which are good for getting rid of lice and/or scabies, of course. Anti-infectives, which treat fungal, bacterial, and viral infections. And burn medications, which are used to, again, prevent infection in burn patients. They don't necessarily heal the skin any quicker, they just prevent infection. Because usually with burn patients, there's sort of an open area of skin or missing layers, so we want to make sure that we're not allowing bacteria to get in there. And last but not least, agents used to treat acne. So we'll start with antipruritics. Now, if you remember from med term, pruritus is basically itching. So anti meaning against, so not itching. They're used short-term to relieve discomfort from allergic reactions, poison ivy, hives, and insect bites. They can be a few different ways of treating the itchiness. It can be a local anesthetic, which numbs the area. It could be a drying agent, an anti-inflammatory agent, or an antihistamine, which histamine is a compound in the body that causes the itching. It's a response, the body's immune response to an insect bite or poison ivy. So, chapter 26 goes into further information on antihistamines. I don't think we end up covering that in this particular module, but just to give you an idea. Side effects can, and this is the funny part about skin medications, we're almost always treating itching or burning. Side effects, itching and burning. You hope not, but in this case, if it's worse than what's already going on, we kind of try another agent. So, allergic reactions, if somebody has a sensitivity to something in the medication, in that case we would discontinue it and use another agent. Or sedation, if you're taking an oral antihistamine to prevent, to kind of treat systemic itching, sedation can occur. It can make you drowsy, tired, fatigued. So, precautions that we want to look out for here is, again, those allergic reactions, as well as prolonged use, and we're going to cover that in the next section. So one thing I always like to point out with Benadryl, which is available both orally and topically, generally we always recommend oral Benadryl. It works a little better, and the topical one can cause sort of hypersensitivity reactions and doesn't work as well. So just a little pearl of wisdom moving forward for you to keep in mind. Corticosteroids are, you'll hear methylprednisolone, what are some other ones that I'm thinking of? Hydrocortisone is really popular over the counter. There are a ton of corticosteroids prescription-wise that are available. And methylprednisolone that I mentioned is an IV medication that's primarily used in the hospital. Topical steroids are available in different dosage forms as well as potencies. Some are low potency and some are very high. Steroids help with inflammation and itching. We generally only use this topical corticosteroid, or in general a corticosteroid, if there is itching with the presence of swelling, because we want to bring that swelling down. Some side effects, and this is important to remember. Prolonged use with corticosteroids topically can lead to thinning of the skin, which can lead to increased risk of infection for the patient, because now their skin is thinner and it's less of a barrier to all the things around us. Irritation, burning, ulceration, especially if the steroid is covered up with the dressing, and slower healing times. So we want to be careful with how long we're using these topical steroids. And again, it kind of goes along with the precautions and contraindications. We would never want to put it on open wounds. We don't want to use it for too long. If they're taking it by mouth, steroids can't be abruptly discontinued. They have to be tapered down, because otherwise it can lead to a response from the body that can put the patient into a dangerous situation. And again, hypersensitivity to any of the medications would require us to stop it. So, emollients and protectants are exactly what they sound like. They're used to soothe or soften and protect the skin and create a barrier to seal out wetness. And you would use it in situations such as diaper rash, because we are exposing that little baby bottom to constant wiping or wetness. We kind of want to put a barrier over it to prevent any fungal infections such as diaper rash. If you have an irritation or a minor burn, you might put an emollient over it to protect it. Keratolytics. Usually the most common one is salicylic acid, and basically it breaks down the top layer of dead skin and gets rid of it. You might see it used in dandruff, seborrhea, or psoriasis, or to promote peeling of the skin, such as in acne, corns, calluses, etc. And it can cause, just like any other topical skin medication, severe skin irritation, stinging, burning, light sensitivity, and of course irritation to any of the mucous membranes found in our nose, our eyes, etc. So we avoid open areas of the skin, as well as anytime somebody has an allergic reaction to the medication, we try to avoid it as well. Enzyme preparations. Sorry, the dog is around here somewhere, wiggling her ears. Enzyme preparations. So you most commonly see those in patients with bed sores. Anytime someone's in bed for too long, you might have, if they're not being rotated properly, you might have bed sores, and those are basically a breakdown of skin, and it is easier for the patient to get an infection in that area. The technical term is decubitus ulcers, or pressure sores. Diabetic patients are also prone to these because they don't have great blood flow, so they also might have skin breakdown in the area. If an area is not getting enough blood, it tends to die, and that skin will break down and cause what's called a diabetic ulcer. So what we do with these is we put something in them called collagenase, which is an enzyme ointment. You might also hear it referred to as Santal. And it's basically, instead of physically actually rubbing the skin and getting rid of it, such as you might with a foot file or something of that nature, you put a chemical into it that basically does the same thing. It gets rid of dead necrotic tissue. So we try not to use those. We don't ever use those if, or we don't use them with detergents, iodine, etc., which prevents them from working. Next, everybody's favorite topic is scabicides and pediculicides. Scabies are an itch mite that burrow below the skin, and pediculicides are used for basically head lice, etc. These are pretty common in schools. You know, they spread from child to child, kind of like wildfire. Once one kid has it, pretty much the whole class is going to get it unless precautions are taken. And in addition to all the clothes washing, etc., bedding, treatment, toy treatment, whatever you might do, we have permethrin, which is available. Permethrin 5% treats scabies, permethrin 1% treats head lice. With scabies, we generally apply it from neck down, and it's left on for a number of hours before it's washed off. Head lice, there's, you know, you don't leave it on for as long, you wash the hair and then wash it out, and then they remove the nits. Lindane is another option that is available. We try to avoid it, and I believe that's on the next page, because it can be toxic. It can be absorbed systemically following topical application, and it's usually avoided definitely in pregnant and lactating women, as well as in children and infants and the elderly, specifically because they metabolize things differently than a normal adult would. So the only time we really would use Lindane is if the person fails a treatment with permethrin or can't tolerate the permethrin. Okay, moving on to antifungals. Antifungals that you may know of over the counter usually treat fungal foot infections like athlete's foot, can also treat diaper rash with a baby, and other things such as ringworm or jock itch. So side effects, again, itching, burning, nothing serious, just hypersensitivity reactions that can occur. Antivirals, you may be familiar with topical cold sore medication. That's sort of where you see those. I'm not going to get too into depth with those. Generally, it's to kind of lessen the amount of time that you may have lesions. It doesn't necessarily cure it, but it can help kind of bring, you know, the time that you have to deal with those lesions down. Antibacterial agents. There's a ton of them out there. The book doesn't go into too much detail, The only thing it does cover is mupirocin, which is an antibacterial ointment that is used to prevent or treat MRSA, especially in patients who might be going in for surgery. They'll use it for nose, basically a nose ointment, and that helps cut down on MRSA colonization. So, next, antiseptics. They prevent the growth of bacteria. Most disinfectants are too strong to use in the skin, but we can use antiseptics, which will help cut down on the amount of bacteria found on the skin. The most common ones are chlorhexidine and iodine. Chlorhexidine you'll see used a lot in ventilated patients. They'll do a mouth rinse with chlorhexidine every day because ventilated patients are more prone. They have, an external tube shoved down their throat, so they're more prone to infection. Whenever you introduce an external equipment in, it leads to increased risk of infection in that patient. Chlorhexidine can cause irritation just like any other skin medication, as well as photosensitivity and allergic reactions. Let's see, iodine, again, allergic reactions, not used on open wounds because it can cause even more stinging and pain there, and not generally used in pregnant women too often, or newborns. Burn medications, kind of similar, they're just used to prevent infection. Again, I think I covered that earlier. We don't want to think that they're being used to treat the burn. Really, it's being used to prevent infection in that burn and keep the patient safe. So, acne agents. I'm sure we're all familiar with these. There's over-the-counter, there is prescription medications. Sometimes, as we talked about before, they're keratolytics to break the top layer of skin down. Other times, they're actual oral medication. Sometimes they'll use antibiotics to help treat acne. There's a ton of different options out there. It's just a matter of which option works best for the patient. So, chapter 21 will be a separate post, and again, back in a minute.